people try to hide their Indigenous identity to receive care. If they can pretend to be something other than they are, maybe, just maybe, the nurse, the doctor, the specialist will treat them kindly, treat them equitably.
That's Wabano Center's Alison Fisher talking about a new report called Share Your Story. And the findings are alarming. 78% of those surveyed reported experiencing anti-Indigenous racism in the healthcare system. 78% said they believed they would have received better service if they were non-Indigenous. 69% indicated reduced use of the system due to experienced racism. Fisher says, sadly, none of the results are surprising.
We've heard hundreds and hundreds of these stories through the years, and it was finally a culmination of just sort of people's weariness with the fact that the stories didn't change. The problems were still there year after year after year.
The report interviewed more than 200 Indigenous people in 2018 and 2019. One of them is Ottawa Aboriginal Coalition co-chair Mickey Adams. Starting in 2018, she went to hospital numerous times with a serious chest infection, but was continuously sent home because staff assumed she was intoxicated.
And so on 5 separate instances, I thought I was going to die and I was going to have a heart attack. On the 4th and 5th instance, my husband pretty much had to drag me to the hospital because I didn't want to be stereotyped or put down or ignored while I was at the hospital in pain.
Adams says she fully understands why many Indigenous people avoid seeking medical treatment, even when they desperately need it.
It's very frustrating, aggravating, and upsetting, because I know I needed the help, but I didn't want to go to the hospital to get the help.
The report makes a total of 27 recommendations on how healthcare providers can tackle racism within the system. But Fisher says the most important step is for those running the system to acknowledge racism exists.
I think one of the most fundamental things that we're trying to tell the institutions here is they have to take ownership. They've never taken ownership of the issue. So that's the fundamental beginning of this roadmap that we've laid out for them in this document, is to take ownership and commit to equity, to health equity.
Fraser Needham, APTN National News, Ottawa.